if you as a patient have gone through this continuum of care where you've seen a primary care provider, you've seen a physiotherapist, you've had a multitude of tests, and now it's been, let's say, 3 to 6 months before you have seen your provider again and there are really no answers, we've found that a lot of patients are now starting to ask for advanced imaging such as MRI scan, and this was the crux of our argument. And most of shoulder pain patients don't really need an MRI scan to solve their problem. And we saw that there was a lot of potential misuse of an MRI in the system, both in terms of wasted dollars for a test that really wouldn't lead to a change in the patient's management, and also to try to get these costs under control and funnel them into other programs that would potentially help patients by granting them early access or improved access to physiotherapy.
And so the question around the MRI, I think, is just sort of the patient being exasperated of like, what's going on in there, right? And them wanting to find that next level.
Absolutely.
But you're saying it might be a misguided sort of step for there's no new information coming out of that.
Well, I think that's a double-edged sword. So patients wanted an answer and they thought that an MRI scan would provide them with an answer.
Yes.
And the second thing is that oftentimes a barrier for referral to an orthopedic surgeon in Ontario would be that they wouldn't look at that referral unless an MRI scan was sent along with it.
Okay.
And so again, where a test doesn't necessarily alter the treatment or management plan, I think that that's a wasted test, both in terms of time that the patient spent waiting for that test,
yes,
and both in terms of the healthcare dollars that are spent within our system doing a test that doesn't result in a change in their management.